Hello and welcome to today's webinar. I'm so glad you could join us, and today we will be discussing something on the minds of many, how the Inflation Reduction Act will affect your Medicare prescription drug coverage in 2025. We know that Medicare can sometimes be a bit overwhelming, especially with all the changes coming. That's why we're here to help you understand what's coming, how it impacts you, and what steps you might need to take. We'll explain everything clearly and straightforwardly so that by the end of this webinar, you'll understand what to expect, how to make the most of your changes, and we thank you for being here, so let's dive in. Hello, I'm Darren Whitehour, and I am your local independent insurance agent, and I'm here to help you navigate the complex insurance world with a personal touch. Let me tell you a little bit about myself. I served 22 years in the United States Air Force as a cyber warfare officer, and now I'm dedicated to serving our community as an independent insurance agent. I specialize in Medicare Advantage, Medigap, sometimes known as Medicare supplements, prescription drug plans, Social Security maximization, and Social Security claiming strategies to include life insurance, annuities, and long-term care planning. Before entering the insurance field, I was a professor at Loyola Marymount University. I taught subjects like aerospace, leadership, management, history, and even physical training. I've had the privilege of lecturing at over 54 colleges and universities across the entire country. Also, while living in Europe, I also had the incredible opportunity to teach civil engineering contingency operations for our NATO allies. In addition to my insurance expertise, I am a gerontologist, which means I studied the senior population's lifespan and aging process, focusing on the psychology and sociology of aging. I've also completed law school and earned 5 other master's degrees in various fields, including psychology, long-term care, alternative dispute resolution, information technology, and business administration. I am passionate about helping you find the right solutions for your needs, and we're honored to be part of your journey. Thank you for allowing us to serve you. As your local licensed insurance agent, I thank you all for joining us today. Medicare can be overwhelming, but I'm here to guide you. I want to start by letting you know a little bit about what I do. I'm licensed and certified and trained specifically to understand how Medicare works. Every year, I dedicate over 80 hours to obtaining certifications from many of the top carriers. To give you some perspective, attorneys, nurses, CPAs, physicians typically only complete around 20 educational hours annually. If you are an attorney or a physician or any one of these I named, please don't take offense. This is something we found online comparing our fields. One key part of my education is passing an annual AHIP exam. This exam covers the basics of Medicare and essential topics like fraud, waste, and abuse of Medicare. This ensures I stay updated with all the latest changes and regulations. But beyond certifications and exams, what matters is how I can help you. I'm trained to use Medicare.gov and many tools to review your prescription drugs and find a plan that fits your needs and budget. I know everyone's situation is different, and I aim to ensure you have the best coverage for you. Again, being a licensed insurance agent, I pledge my service and undivided loyalty to you. As you start navigating the world of Medicare, I want you to know that you don't have to do it alone. I aim to provide knowledgeable and personalized guidance to help you understand your Medicare plan. This isn't a one-time interaction. I'm here for you all year round. As I said, each year I spend over 80 hours getting certified by top carriers to ensure I am up to date with the latest changes and offers. That way, I can provide the most accurate and relevant information to help you make informed decisions. And if you ever have any questions and concerns, whether it's about your current plan or something new you're considering, I'll be here to assist you. I also offer a no-cost annual plan review. This means that we'll sit down together, review your current coverage to make sure it all still meets your needs. If anything changes, whether it's your health, your prescriptions, or your financial situation, we'll find a plan that works better for you. My commitment to you doesn't end after our first meeting. I'm dedicated to being a resource for you as your needs evolve. So let's work together to ensure you have the right coverage, and I'm here to help, not just today, but every step of the way. Today's agenda will cover the basics of Medicare Parts A, B, C, and D. We'll also discuss the Inflation Reduction Act and the significant improvements coming to Medicare for Part D in 2025. We'll explore how these changes might impact your coverage and what can you do as a Medicare user to navigate these updates. I'll provide a comprehensive overview of Medicare to wrap things up, and my goal is for you to leave this session feeling more informed and confident about your Medicare choices. I'll be here to answer any questions you have. So let's dive in and get started and make Medicare easy to understand. Here are the basics of Medicare. Let's make sense of Medicare, especially as you explore your options. So let's start with the basics. What exactly is Original Medicare? Simply put, Original Medicare comprises two parts. Medicare Part A, which covers hospital insurance, and Medicare Part B, which covers your medical insurance. These two parts are the foundation of what the federal government offers as Medicare. And you'll often hear this referred to as Original Medicare. While Original Medicare provides essential coverage, it doesn't cover everything. That's where your options come into play. You can add a Medicare supplement plan, which covers some of the costs that Original Medicare doesn't, like co-payments, co-insurance, and deductibles. Another important option is Medicare Part D, which provides prescription drug coverage. This is essential because Original Medicare doesn't cover Part D prescription medications. Lastly, there's Medicare Part C, also known as Medicare Advantage. This is an all-in-one alternative to Original Medicare. Private companies approved by Medicare offer Medicare Advantage plans, many of which include prescription drug coverage, or what we call an RX plan, along with additional benefits like dental, vision, and hearing coverage. So our job is to help you understand these options and find the best combinations for your healthcare needs and budget. So whether you're looking to stick with Original Medicare or add some extra coverage or consider a Medicare Advantage plan, we're here to guide you through the process. So let's ensure you're set up with the best coverage for you. Now, I want to discuss something that could affect you, especially your healthcare expenses. It's called the Inflation Reduction Act. Now, I know that the name might sound a bit dry, but trust me, this can have a tangible impact on your wallet. The Inflation Reduction Act was designed to tackle inflation and provide some relief to folks like you and me. One of the key areas this act addresses is the cost of prescription drugs. If you're like many people, you might be worried about how much you are spending on your medications. The good news is that this act has made some critical changes to help lower those costs. For example, it allows Medicare to negotiate prices for certain high-cost drugs. That means you might see a reduction in what you're paying for your prescriptions. Another aspect of the act is the cap on the out-of-pocket cost for medications. Starting in 2025, there's going to be a limit on how much you can spend out-of-pocket for covered drugs. This cap is a huge relief and can help you budget more effectively. The Act also provides more support for preventive services. This means you can get certain vaccines and screenings at no cost, helping you stay healthy without worrying about those additional expenses. I know navigating the changes can feel overwhelming, but that's why we're here. The cost of prescription drugs is a big concern. So what are other people thinking? Well, first off, you're not alone in feeling this way. Did you know that 82% of adults think the cost of prescription drugs is unreasonable? And about 30% of those people, just like you, have had to skip or adjust their medications in the past year because it was too expensive. That's a significant number and it's a real issue, but also 28% of adults say it is tough for them to afford and pay for their prescription drugs. The good news is that the changes on the horizon could help alleviate some of that stress. The Inflation Reduction Act, which I mentioned before, is one of those such changes. It aims to make those prescription drugs more affordable and accessible for everyone, especially for those on Medicare. I understand these issues can feel overwhelming, and having a trusted resource to help you navigate them is crucial. If you want advice on managing your prescription costs, I am here, and we aim to ensure that you have all the information you need to make those best decisions for your health and budget. The government sees the Inflation Reduction Act as a real solution to some of the challenges that our Medicare beneficiaries have faced. This act was created to provide meaningful financial relief and bring some much needed improvements to our Medicare plans. So, what's in it for you? First, let's talk about access. The act was designed to increase your access to treatments and expand the services available under Medicare. This means you'll have more options when it comes to your health care. This can lead to better outcomes and a peace of mind, knowing that your care you need is within reach. Next, there's affordability. We all know that healthcare costs can add up quickly, especially when it comes to prescription drugs. The Inflation Reduction Act aims to lower those costs by allowing Medicare to negotiate the prices for certain expensive medications. Plus, it's also limiting how much drug prices can increase each year. So you can expect more predictable costs and fewer surprises when you go to the pharmacy. Finally, this act is about making the Medicare program more sustainable, not just for today, but for the long run. By addressing some of the financial challenges within the program, the government hopes to ensure Medicare remains strong and reliable for years to come. That means you can feel more secure knowing the benefits you depend on will be there when you need them. Let's talk about some important changes coming your way through the Inflation Reduction Act, specifically around your Medicare Part D. Now, I know Medicare can sometimes feel like a maze, but these updates are really designed to make things a bit easier and hopefully a bit lighter on your wallet too. I want to walk you through the exciting changes that have been happening and are still coming up with Medicare Part D. These changes are all part of that Inflation Reduction Act, and they're designed to make managing your prescription drug costs a lot easier. Let's look at what's already changed and then what's coming. So in 2023, we've seen that some significant improvements, and first of those improvements were vaccines. Vaccines are now available without copays, which is a big help to keeping you healthy without those extra out-of-pocket expenses. And for those who rely on insulin, there's been significant change. You're now paying no more than $35 a month for your insulin. That's a massive relief for many people needing that life-saving medication. Then in 2024, even more positive changes happened. One of the big ones is the expansion of the eligibility for the Extra Help Program, also known as the Low Income Subsidy, LIS. If you've ever had trouble affording your medications, this could be a game changer, as more people will qualify for the Extra Help Program. And another meaningful change is that the elimination of the 5% coinsurance in the catastrophic phase of your prescription drug plan is eliminated. So if you've ever reached this phase, you know how much that 5% can add up. But starting in 2024, you don't have to worry about that extra cost, making your medications more affordable even if you don't need a lot of them. And finally, 2025 is bringing some of the most significant changes yet. Starting in 2025, there will be a $2,000 annual cap on your out-of-pocket prescription drug costs. This is a big one because once you hit that $2,000 mark, you'll have no more medication costs for the entire year. It's designed to provide your financial peace of mind, helping you budget more predictably. Here's a new option that could make managing your prescription drug costs much easier. This is the Medicare Prescription Payment Plan. Now, I know that keeping track of medical bills and out-of-pocket costs can be very stressful, especially when it comes to your medications. But this new plan is designed to take care of some of that worry and take it off your shoulders. So, what is the Medicare Prescription Payment Plan? Well, simply put, it's a way to spread out your out-of-pocket prescription drug costs over the entire plan year instead of paying big chunks all at once. This makes it more manageable for you to budget and keep up with your healthcare expenses. One of the most important things to remember is that your out-of-pocket prescription drug costs will be capped at $2,000. This means that no matter how many medications you need or how high the costs get, once you hit that $2,000 cap, you won't have to pay any more for the rest of the year. Here's how it works. Once you're enrolled, you'll be charged $0 at the counter when you go to the pharmacy. That's right, nothing out of pocket at that moment. Instead, your plan will take care of the upfront costs, and then you'll receive a bill from your plan later for any of those out-of-pocket expenses. It's important to know that your deductible still needs to be paid first, and copays may apply depending on the plan that you choose. And because this is a payment plan, your monthly bill might fluctuate based on how much you've spent on prescriptions that month. Some months might be lower, others a bit higher, but the idea is to ensure you're not hit with that large unexpected cost simultaneously. And here's something else I think you'll appreciate. You can opt out of the plan anytime. If you decide it's not working for you, no worries. You'll just need to pay off what you owed, and you can go back to your previous payment method. This plan aims to give you more control over your healthcare costs and make it easier to manage your budget throughout the entire year. I understand that these changes might seem complicated, but that's why I'm here with you today. How does the Medicare prescription payment plan work, especially when your drug costs vary throughout the entire year? This plan is designed to make your out-of-pocket costs more manageable by spreading them out over the year. Let's take a closer look at how it all adds up. Look at this chart with 6 columns. In one column, we got the month your out-of-pocket costs were incurred, how those costs are spread across the remaining months of the year, then the split costs and the maximum monthly cap, and finally, what you'd pay each month. Let's start with January. In this example, January shows no drug costs, but I want to show you, look at the max monthly cap column. You'll see $166.67. That's the most you could be charged per month if you had a $2,000 drug cost in January. Why? Because 2,000 divided by 12 is $166.67. This is your monthly cap if all your drug costs are required upfront in January. Now, let's move to February. Here the chart shows a drug cost of $1,200. Since it's February, there are only 11 months left in the year. So we divide 1,200 by 11. That gives us $109 per month. If this were your only drug cost for the year, your monthly payment would be $109 monthly. But we're not done yet. Let's go to March. In March, you have another small chart, just 12 bucks. We divide that 12 bucks by 10, since 10 months are left in the year, which comes out to $1.20. We add that $1.20 to your $109 from February, so now your new monthly bill is $110.29. But let's skip down to August where we have a bigger chart. So in August, you see a larger drug cost of $530. Now, since there are 5 months left in the year, we divide 530 by 5. That gives us $106 per month. Add that to your July max cap, and your new monthly bill becomes $249.84. So, what does all this mean? By the end of the year, your out-of-pocket costs are spread out in a way that helps you manage those payments without getting hit with a huge bill all at once. The most you'll pay total for all your drugs over the year is $2,000, which is the cap. And remember, all your drug costs for that year must be paid by the end of that calendar year. Then everything resets at January 1, and the process starts over again. I hope this breaks down and makes more sense, but if it doesn't, don't worry. We can always sit down together one-on-one and go through it step by step. My goal is to make sure you feel comfortable and confident with your Medicare coverage. Understanding the 2025 updates can feel overwhelming, but I'll walk you through them step by step. So, what's happening in 2025? Well, Medicare is making some significant improvements to the Part D program. The most notable change is the redesign that removes the coverage gap, which was often called the donut hole. This gap has been frustrating for many, so I'm thrilled to tell you it's being phased out. So let's break it down into the 3 new phases. Well, phase 1 is the annual deductible, the same as all years. This is the first phase, where you pay out of pocket for your prescription drugs until you reach your plan's deductible. In 2025, this deductible can range from $0 to $590, depending on your specific plan. Once you hit that deductible, you move into the next phase, phase 2. The initial coverage phase. This phase is your insurance plan begins to share the costs with you. You'll pay your share through copays, coinsurance, and then this phase lasts until you reach that new maximum out-of-pocket cost. of $2,000. Again, this happens in 2025. Now, you're done paying for the year once you reach that out-of-pocket cost of $2,000. And here's where it gets even better. Phase 3 is now the catastrophic coverage phase. In 2025, the coverage gap or donut hole is now removed, which used to be phase 3, and replaced with the catastrophic phase, which used to be phase 4. So once you've reached that $2,000 out-of-pocket maximum with your plan, the drug manufacturer and Medicare will take over and pay your prescription drug costs for the rest of the year. That's right, you won't have any more copays, co-insurance once you've hit that $2,000 mark. It's designed to give you that peace of mind knowing you won't face any more unexpected costs for the rest of the year. To sum it up, in 2025, Medicare Part D will become more straightforward and more predictable. You'll have 3 phases to go through, and once you reach that $2,000 out-of-pocket maximum, your plan, the drug manufacturer, and Medicare cover the rest. No more worrying about that donut hole or additional costs later in the year. Understanding how the manufacturer discount program works can help you save on your prescription drug cost. So let's dive into it. Let's start with the basics. The manufacturer discount program is about providing savings on the brand name drugs throughout the different phases of your Medicare Part D coverage. But how does it all work? Well, it depends on which phase your coverage you're in. Now, in phase 1, the annual deductible phase, in this phase, you're paying out of pocket until you reach your deductible, and unfortunately, the manufacturer discount program doesn't apply here. So you won't see any discounts from drug manufacturers in this phase. Now, moving on to phase 2, the initial coverage phase. This is where the savings start to kick in. During this phase, drug manufacturers will provide a 10% discount on all applicable brand name drugs. This means that on top of what your plan covers, you'll get an additional break on the cost of your medication. It's part of their cost share to help make your prescriptions more affordable. Now, finally, let's talk about phase 3, catastrophic coverage. Once you've reached that $2,000 out-of-pocket maximum and your plan takes over the total cost of your drugs, the manufacturer discount program continues to help, and that's where the manufacturers will provide a 20% discount on all applicable brand name drugs in this phase. That's right. On top of your plan covering those costs, you're getting an additional discount from these drug manufacturers. But here's an important note. For these discounts to apply, participating drug manufacturers must agree with CMS, the Centers for Medicare and Medicaid Services, that this agreement ensures that the brand name drugs you rely on are eligible for these discounts within the Part D program. It's a partnership designed to ensure you get the best possible deal on all your medications. So, what does this mean for you? Well, in 2025, you can expect to see that the manufacturer discounts helping to reduce your prescription drug costs as you move through the different phases of Part D coverage. It's one more way that Medicare is working to keep your out-of-pocket expenses manageable, and especially when it comes to those brand name drugs that can be costly throughout the year. If you have any questions about how the manufacturer discount program works, or want to discuss how this affects changes that might affect your specific situation, I'm here to help. Here I'm going to walk you through how we got to where we'll be in 2025. So, with Medicare Part D and how your brand name drug costs are shared, it's a bit of a journey, so let's take it one step at a time. First, let's look at 2023. Here, if you had brand name drug costs, you could have paid around $3,100 throughout the year. Now, that $3,100 was split across 4 different phases. Phase 1 being your deductible phase. Here you were responsible for 100% of your deductible. That means you had to pay the total amount before your plan kicked in to help. Phase 2, the initial coverage phase. Once you hit your deductible, you were responsible for 25% of the drug cost, while your insurance carrier took care of the other 75%. Phase 3, the coverage gap, also known as the donut hole. This is where things got a bit tricky. In this phase, You were still on the hook for 25% of the drug cost, but your insurance carrier only covered 5%, and the drug manufacturer stepped in to cover the other 70%. Phase 4, catastrophic coverage. After you paid a certain amount out of pocket, you entered this phase where your responsibility dropped to 5%. Your insurance carrier picked up 15%, and Medicare covered the lion's share at 80%. Well, let's fast forward to 2024. Things changed a little bit. Your out-of-pocket costs could have been around $3,250. Again, these costs were spread across 4 phases, similar to 2023, but in the catastrophic coverage phase, your responsibility dropped to 0%. Yes, you didn't have to pay anything more. Instead, your insurance carrier covered 20% and Medicare paid 80%. Now, let's talk about the significant changes coming in 2025. This is where it gets interesting. In 2025, your maximum out-of-pocket cost for brand name drugs will be capped at $2,000. This is a significant change that will make a big difference for many of you. Here's how that $2,000 will be split. In phase 1, the deductible phase. Like before, you'll be responsible for 100% of your deductible. No changes here. Phase 2, the initial coverage phase. Once your deductible is met, you'll still be responsible for 25% of the drug cost. But your insurance carrier will now cover 65%, and the drug manufacturer will chip in with a 10% discount. Phase 3, now catastrophic coverage. This is where the big changes come in. After you've reached that $2,000 out-of-pocket maximum, you won't have to pay anything more for the rest of the year. Your insurance carrier will now cover 60%, and Medicare will handle the 20%, and the drug manufacturer will continue to contribute with a 20% discount. Now, here's the key takeaway. Notice who is becoming more responsible for covering your drug cost. It's the insurance carrier and the drug manufacturers. This shift is a big deal, so I strongly recommend that you review your Medicare plan very closely this year. These changes could significantly impact your out-of-pocket expenses on the medical part and the prescription drug plan. And I want to ensure you're in the best possible position to take advantage of these updates. There's much more to discuss. I'll explain these changes in even more detail later. But for now, I'm here to help you navigate these updates and ensure you're fully prepared for what's coming in 2025. All right, now we're going to discuss generic drug costs. And I'm going to walk you through how we got to where we'll be in 2025 with Medicare Part D and how your generic drug costs are shared. It's a bit of a journey, so let's take it one step at a time like we did with the brand name drugs. First, looking back at 2023, if you had brand name drug costs, you should have paid around $3,100 throughout the year. Now, that $3,100 was split across 4 phases, and those different phases are phase 1, the deductible phase. Here you're responsible for 100% of your deductible. That means you had to pay the total amount before your plan kicked in to help. Phase 2, the initial coverage phase. Once you hit your deductible, you were responsible for 25% of those drug costs while your insurance carrier took care of the other 75%. Phase 3, the coverage gap, also known as the donut hole. This is where things got a bit tricky. So we're still on the hook for 25% of the drug costs, but your insurance carrier covered 75%. Now phase 4, catastrophic coverage. After you paid a certain amount out of pocket, you entered this phase where your responsibility dropped to 5%. Your insurance carrier picked up 15% and Medicare covered the other 80%. Fast forward to 2024, things changed a little bit. Now your out-of-pocket costs could have been around $3,250. And again, these costs are spread across 4 phases similar to 2023. But in the catastrophic coverage phase, your responsibility dropped to 0%. Yes, you didn't have to pay anything more. Instead, your insurance carrier covered 20% and Medicare paid 80%. Now, let's move on and see what the significant changes are for 2025. This is where it gets interesting. In 2025, your maximum out-of-pocket costs for brand name drugs will be capped at $2,000. This significant change will make a big difference for many of you. And here's how that $2,000 will be split. Phase 1, deductible phase. Like before, you'll be responsible for 100% of your deductible, and there are no changes here. Phase 2. This is the initial coverage phase. Once your deductible is met, you'll still be responsible for 25% of those drug costs, but your insurance carrier will cover 75%. Phase 3 is now the catastrophic coverage since we removed the coverage gap, and this is where the big changes come in. After you have reached that $2,000 out-of-pocket maximum, you won't have to pay anything more for the rest of the year. Your insurance carrier will cover 60% and Medicare will handle 40%. Again, the takeaway. Notice, who's becoming more responsible for covering your drug costs? It's your insurance carrier and the drug manufacturer. Again, this shift is a big deal, so I strongly recommend that you review your Medicare plan very closely this year. These changes could significantly impact your out-of-pocket expenses on the medical and Part D premiums of your plans. And I want to ensure you're in the best possible position to take advantage of these updates. As I said, there's much more to discuss, and I'm here to help you navigate these updates and ensure you're fully prepared for what's coming in 2025. As I said, Medicare can be a maze of rules and changes, and keeping up with it all can be overwhelming. But I'm here to guide you through some of the essential updates coming your way thanks to the Inflation Reduction Act. Updates aimed at making Medicare a bit easier to navigate and hopefully a little bit lighter on your wallet. We'll start with the big one, Medicare drug price negotiations. Next, we'll discuss Medicare inflation rebates from 22 to 25, and finally, some changes to Medicare Part B made starting in 2023. Here are the key changes coming to Medicare, changes that could significantly lower your healthcare costs, especially when it comes to prescription drugs. Let's start with Medicare drug price negotiations. This is a significant shift that will kick off in 2026. The focus is on improving access to some of the costliest single-source brand-name drugs under Medicare B and Medicare Part D. Initially, Medicare will start negotiating prices on 10 selected drugs. These are the ones that many of us rely on, but they can be incredibly expensive. The first 10 drugs for 2026 are Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, Fiasp, and different Novalogs. Now, what's important to understand is that these negotiations are just the beginning. Every year after 2025, additional drugs will be selected for price negotiation. This is all about ensuring you can afford the medications you need without worrying about sudden, unaffordable costs. And next up are the inflation rebates for Medicare. This is another step toward controlling drug prices. Starting in the fall of 2025, drug companies will be required to pay a rebate to Medicare if they increase the price of certain drugs faster than the inflation rate. This will keep prices in check and ensure that costs don't spiral out of control. The Centers for Medicare and Medicaid Services, CMS, will handle the calculations and invoicing for these rebates. So, what does this mean for you? It means more stability and predictability in your prescription drug costs, which we can all appreciate. Finally, let's talk about some changes to Medicare Part B. These changes are designed to improve access to high-quality, affordable medications, especially for those biosimilars. And those biosimilars are drugs made from natural resources, and they can be more cost-effective alternative to some of those brand name drugs you might be using. So, other significant update is that the $35 per month cost-sharing cap on insulin used in durable medical equipment pumps, which went into effect in 2023. And if you or someone you know relies on that insulin, this could make changing diabetes much more affordable. I know this is a lot of information. Still, these changes are about making medications more sustainable and ensuring access to these medications and treatments you need without breaking the bank. If you have any questions or want to know how these changes might affect you personally, I'm here to help. Let's navigate these updates together, and you can feel confident and secure in your healthcare choices. Earlier, I promised to explain how the Inflation Reduction Act could impact your Medicare coverage. So let's dive into that. What can be expected with the big changes coming in 2025? Let's start with something I know will catch your attention. Your out-of-pocket prescription drug costs will be capped at $2,000 yearly. That means no more worrying about those surprise costs piling up once you hit that $2,000 limit. You won't pay another dime for your medications for the rest of the year. And if that number still sounds like a lot, there's more good news. Starting in 2025, you can spread those costs out with a monthly payment plan. And this could reduce the stress of managing your finances, making budgeting and planning easier. And another great thing about these changes is the brand name drugs, which might have been too expensive before, could become more affordable and accessible. You won't have to choose between your needed medication and your budget. With the new discount and rebate programs coming into effect, manufacturers planning to hike up prices will face penalties, keeping your costs down, beating inflation at its own game. And here's something, I know it's important to you, your medication choices should remain the same. Now, no drugs are being excluded from these changes, so you'll continue to have access to the treatments that work best for you. However, these upcoming changes are all about making Medicare coverage work better for you, keeping your costs down, giving you more options, and removing some of the financial worries. If you have any questions or need help understanding how these changes affect you, let's navigate these changes together so you can focus on what matters most, your health and well-being. As we look ahead to the changes coming in 2025, I want to share a few things you should be aware of regarding Medicare Part D. First, let's discuss the Medicare Prescription Payment Plan. This plan will be especially helpful at the beginning of the year. It's designed to spread out prescription costs over time, making it easy to manage the expenses without feeling the pinch all at once. However, if you qualify for extra help, also known as low-income subsidy, you might find that enrolling in this program is even more advantageous than the Medicare Prescription Payment Plan. But don't worry, the payment plan is still available to all beneficiaries, so you can choose the option that works best for you. Now, here's something important. Keep in mind, if you've paid more than the 2025 annual cap of $2,000 between January 1 of 2024 and September 30th of 2024, your plan is required to reach out to you about the payment program. They'll ensure that you know about it and help you take advantage of it if it's the right fit. It's also worth noting that not all drugs are included in the Medicare Prescription Payment Plan. Non-covered Part D and Part B drugs are excluded, so you'll want to consider that when planning your budget. These changes are all about giving you more control and options regarding prescription drug costs. Continue to ensure you're aware of some crucial details about the changes to Medicare Part D. First, let's talk about the $2,000 cap on out-of-pocket costs. It's a great relief for many of us, but it's important to note that this cap doesn't apply to Part B drugs, only to your Part D drugs. Now, once you start incurring out-of-pocket costs under Part D, the new payment plan will kick in and cover all your Part D prescriptions that you are billed. You'll be billed monthly, so you won't have to worry about those large one-time payments. But remember, you won't be able to pick and choose which prescriptions to include on the plan. It's all or nothing. If you decide to switch Part D plans or opt out of the payment plan, any amounts you owe will still be billed to you, but don't worry, it won't exceed that monthly maximum cap. This helps keep things predictable and manageable. And one more thing to keep in mind, Part D plans may still choose not to cover certain drugs in their formulary. If this happens, make sure you notice any changes and talk to your doctor about possible alternatives. They can help you find out other options that work well for you. I know this is a lot of information and we're not done yet, so let's continue. I want you to pay close attention to what I'm about to say. Let's talk about your premiums. The new law has capped how much your Part D base beneficiary premiums can increase, and it's no more than 6% annually until 2030. That's some good news. But remember, this doesn't prevent plans from adding other costs that might affect your overall expenses. So it's something to watch closely. Now, something else to be aware of is how the plan sponsors and your insurance provider will handle costs in the catastrophic phase. Their liability is going to increase, which means you might see a bump in your plan costs. While your out-of-pocket drug costs will be lower, this change could lead to some cuts in plan services. It's something to keep an eye on, especially when you're reviewing your plan options. Another critical change is the definition of credible coverage. So credible coverage for prescription drug plans is a term, and it's important because it affects whether your current plan meets Medicare standards. And with the new definition, some plan sponsors might decide they can't meet these standards and could exit the Medicare market altogether. This could mean you'll need to shop around for a new plan if yours decides to leave the market. These are just a few of the changes coming in 2025, and I know it's a lot to take in, but don't worry, I'm here to help you navigate these updates and ensure you're on the best plan for your needs. So feel free to schedule a one-on-one appointment if you have any questions or want to chat about how these changes might affect you. So what can you do? Now, I want to talk to you about ensuring your healthcare needs are handled in 2025. Your health is your priority. You deserve the proper care with a Medicare plan that suits your needs. One of the best ways to ensure you're on the right track is to review your current Medicare plan, and it might seem like a chore, but it is so important. Start by keeping a list of your current prescriptions. This will greatly help when comparing plans and seeing what's covered. Now, here's a key date to remember. September. That's when your plan will send your yearly notice of upcoming changes called the Annual Notification of Changes, ANOC. I can't stress this enough. Pay close attention to this notice. It's your chance to spot any changes affecting your coverage or costs. And if you see something that doesn't feel right or you want to discuss your options, call me and we'll review your changes. You can stay updated on the new law by visiting this website or contacting me. Here are other resources for you to learn on your own. Here I cited all the references I used to create the information I shared with you today. Healthcare changes can be overwhelming. I want peace of mind for you, and I'm here to help simplify that process. I want to take a few moments to review some key points about your current Medicare for 2024. Let's start with Medicare Part A hospital insurance without Medigap or a Medicare Advantage plan. Your monthly premium could be anywhere from $0 to $505 depending on how many quarters you've worked or earned. If you need to be hospitalized, there is also a deductible of $1,632 per service period. For the first 60 days, there's no cost to you, but starting on day 61, there's a $408 copayment per day. And if you're in the hospital longer than 90 days, that goes up to $816 per day. For those of you who might need skilled nursing care, it's covered for the first 20 days at no cost, but after that, it's $204 per day up to 100 days. Beyond 100 days, unfortunately, all cost falls on you. Next up is Medicare Part B, medical insurance without Medigap or Medicare Advantage plans. The standard cost for this plan in 2024 is $174.10 per month. But it could be higher depending on your income. There's also a $240 annual deductible. And once you've met that deductible, you'll typically pay 20% of the Medicare approved amount for most doctor services. So it's important to factor into your budget. Now, let's talk about Medicare Part C, Medicare Advantage. This is an alternative way to receive your Medicare coverage. With these plans, you'll still be covered by Part A and B, but you might also get some additional benefits like prescription drug coverage, which is Part D. The costs for these plans vary, so it's crucial to compare your options and find one that fits your needs and budget. Now, I hope this helps clarify things a bit, so if you have any questions or need to discuss your specific situation, contact me for an appointment and let's make sure you have the right coverage in place for 2024. Continuing, I know prescription drug costs can be a big concern, so it's essential to understand how Part D works. The cost for Part D plans can vary depending on your specific plan, but there are a few key numbers to keep in mind. First, there's a $545 annual deductible. Once you've met that, you'll enter what's called the initial coverage phase, where your plan will help you cover your drug costs up to $5,030, and after reaching $5,030, you'll enter the coverage gap. After that, if your total out-of-pocket spending reaches $8,000, you'll move into catastrophic coverage. Here's the good news. In the catastrophic phase, you won't pay anything for your covered Part D drugs for the rest of the calendar year. That is a big relief for anyone with high medication costs. Now, let's talk about Medicare supplement plans, also known as Medigap. These plans are designed to help with some of the costs that original Medicare doesn't cover, like copayments, coinsurance, deductibles. It's a great way to help manage those out-of-pocket expenses that can add up. However, remember that Medigap plans don't include prescription drug coverage. So you'll still need a separate Part D plan for your medications. And remember, with Medigap, you'll be paying a monthly premium on top of your Part B and Part D costs. I know this can feel like a lot to take in, but I'm here to help you navigate it all, and I'm just a phone call away if you have any questions or need help reviewing your options. Please make sure you have the coverage that best fits your needs for the rest of 2024. I want to walk you through what a Medicare options review looks like. Whether you're new to Medicare or have been on it for a while, understanding your options is key to ensuring you get the right coverage for your needs. Let's start with your group or employer plan. Many of you might still have coverage through a job, either your own or your spouse's. While these plans can be convenient, they often come with higher copays, maybe even deductibles and coinsurance. It's worth looking closely to see if you're getting the most bang for your buck. Next up is Original Medicare. This is the classic 80-20 split. You pay 20% of your medical costs and Medicare covers 80%. It's pretty straightforward, but that 20% can add up, especially if you have frequent doctor visits or need more specialized care. Some of you might be considering a Medicare Advantage plan. These are often HMO or PPO plans. PPO plans allow you the flexibility in seeing doctors in and out of network. However, keep in mind that monthly costs and copays are involved in most cases. HMO plans have networks and typically require referrals to see specialists. You can still choose your doctor, but it must be from the network associated with the plan. The trade-off here is that you get more bundled benefits like dental, vision, or even a gym membership. Lastly, there's an option of pairing Original Medicare with a Medicare supplement plan that's sometimes you called Medigap, along with a standalone prescription drug plan. This option typically comes with a monthly premium, but it allows you to see any provider that accepts Medicare, plus it helps cover those out-of-pocket costs that Original Medicare doesn't pick up, like copayments, coinsurance, and maybe even a deductible. So, what does all this mean for you? A Medicare options review is about taking the time to look at your current situation, what you're paying, your needs, and how you can best get the coverage for your money. I am here to help you navigate these choices so you can feel confident and your Medicare plan is the right fit for you. Why work with me? Well, let me start by saying that I'm not just an independent licensed insurance agent, I'm also a gerontologist. You probably won't find that combination anywhere else. This unique background gives me a deep understanding of the challenges and needs that come with aging, and I bring that knowledge into every conversation we have about Medicare. Here's what you can expect from me. I provide knowledgeable and personalized service tailored to your specific situation. I'll take the time to educate you on all the plans I'm certified in so you can make the best choice for your health and finances. And here's the best part. My services are completely free. Yes, free. There's never a cost to you, but my support doesn't stop there. I'm here for you all year round, ready to answer any Medicare questions or concerns. If you ever run into issues with your plan, doctor, pharmacy, I'm just a phone call away, ready to help resolve them. So, when you work with me, you're not just getting an agent, you're getting someone who genuinely cares about your well-being and is committed to helping you navigate the complexities of Medicare with confidence. Regarding Medicare, I know everyone has different health needs and budgetary concerns. There's no one-size-fits-all solution. That's why I'm here to work with you side by side to find the plan that fits best. And we will navigate your options together, ensuring you get the coverage that aligns with your health and your wallet. It's all about finding what works for you, and I'm committed to making that happen. I'm here to help you navigate your Medicare options, and the best part is there's no cost or obligation to you. Whether you have questions, need guidance, or want to explore your options, I'm just a call or email away. You can reach me, Darren Whitehour, or my wife and partner, Ronalyn, at 888-895-3267 or 702-277-4753. If you prefer email, you can contact me at darrenwhitehour@ecos.care. And as a gerontologist and veteran, I bring a unique perspective to understanding your needs. When you call, you'll be connected directly to a licensed insurance agent, me, ready to assist you. Now remember, I'm here to help you every step of the way, so don't hesitate to reach out. Call now.